You've invested time, money, and trust into your hair transplant. But let me tell you something that surprises a lot of people. Surgery alone doesn't guarantee amazing results. The truth is, what you do before and after can make or break your outcome. And therefore today, I'll give you a roadmap. Lifestyle habits, scalp care, medication prep, and aftercare. So your transplant has the best chance of looking great for life. First up, lifestyle. Your new grafts are living tissue. They depend on your body's environment. And if that environment is poor, even the most skillful surgery won't reach its full potential. Smoking. This one's huge. Nicotine constricts blood vessels and therefore oxygen delivery to your grafts drops. That's like planting seeds and then shutting off the sprinkler system. Even a few cigarettes a day can lower survival rates. Patients sometimes ask, but can I just cut back? No, you need to quit. Ideally a week before and at least 2 weeks after. Alcohol. Alcohol thins the blood and dehydrates you. It also increases swelling and can interfere with healing. A toast to your new hair sounds nice. But wait, at least 2 weeks before raising that glass. Scalp care. Imagine your scalp as the soil where grafts will be planted. If it's flaky, itchy, or inflamed, that soil is unhealthy. Treat dandruff early with a gentle anti-dandruff shampoo. Ketoconazole twice a week is often recommended. Manage seborrheic dermatitis if you have it. Don't try new oils, dyes, or harsh shampoos right before surgery. You want stability, not experiments. And avoid scalp sunburn. A red, irritated scalp on surgery day is like trying to build on a construction site during a storm. Medication prep. If your doctor recommends it, start finasteride before surgery. Why? Because it helps preserve your existing native hairs, which makes the whole result look denser. Finasteride doesn't affect the transplanted grafts, those are permanent, but it stops the surrounding hairs from thinning, and therefore the overall look is better. Minoxidil, whether topical or oral, may also be suggested to stimulate scalp circulation and hair cycling. Think of medication as protecting and fertilizing the forest, while the transplant adds new trees. Now let's talk about aftercare. The do's. Follow instructions. This sounds obvious, but it's where many patients stumble. I give patients a specific washing routine. Gentle dabbing, not rubbing, and create shampoo bubbles and use them. It keeps the scalp clean while protecting fragile grafts. Sleeping position. For the first few nights, sleep with your head elevated, maybe on 2 pillows or a recliner. This reduces swelling. Ignore this and you might wake up looking like you went 3 rounds in a boxing ring. Avoid touching. Even if it itches, your nails are not scalp tools. Scratching dislodges grafts. Pat gently if you must, or use your saline spray for relief. Sun protection. A fresh scalp is sensitive. Wear a loose hat outdoors once your surgeon says it's safe. And avoid direct UV exposure. Sunburn on a healing transplant is a disaster. Check-ins. Go to your follow-ups. Even if you feel fine, your surgeon can spot small issues before they become big problems. Skipping them is like skipping oil changes on a new car. It might run, but long-term reliability suffers. Equally important, the don'ts. Exercise. Don't do it for at least 2 weeks. Increased blood pressure and sweating can loosen grafts and increase risk of infection. I know the gym warriors hate this part, but think of it as healing training. Smoking and drinking. I said it before and I'll repeat it. These two are your grafts' worst enemies. Every cigarette is like squeezing the oxygen hose. Every drink is like thinning the blood that needs to clot. No helmets, tight hats, or beanies. These can rub against your grafts. Patients often ask, but can I wear a hat? Yes, but only when your doctor gives the green light. And it has to be loose, soft, and not touching the grafted zone. You usually need to wait 3 days before wearing these kind of hats. No saunas, steam rooms, or swimming pools. Chlorine and bacteria are not friends of healing. Therefore, give yourself at least 2 to 3 weeks before diving back in. Avoid scratching and picking. Crusts will form. They are part of the healing process. Picking them off early is like pulling scabs. You risk infection and scarring. Basically, in the first 2 weeks, treat your scalp like fragile glass. Handle with care and you'll be rewarded. So here's the bottom line. The surgeon plants the seeds, but you are the gardener. Your lifestyle, your scalp health, your medication prep, your aftercare. They all decide whether your transplant thrives or struggles. And therefore, if you want your results to last and look natural, don't just rely on the surgery. Do your part. If you found these tips useful, hit subscribe for more expert advice. And if you're considering Korea for your transplant, feel free to reach out. I'd be happy to guide you through the process.